So what is the nursing care? What do you need to do? What do you need to monitor for a newborn who has a circumcision? You need to know that the site is going to be assessed for bleeding every 15 to 30 minutes for the first hour, then every hour for the next 4 to 6 hours. Like I said, each facility is going to have a very standard protocol for circumcision care. The other thing you need to do is monitor for the first urine output. After the circumcision, you're going to note the time, the amount, and when it was done. If bleeding occurs to the actual circumcision site, the nurse needs to apply gentle pressure with a folded sterile gauze and hold that pressure. If the bleeding does not subside and it continues to bleed profusely, the nurse needs to notify the physician, and they may need to come in and do some other kind of an intervention to help stop the bleeding. Other things you need to know as the nurse: the glans penis is normally a dark red during healing, and that's kind of the picture that you're looking at over here on the left. It becomes covered with a yellow exudate, usually in about 24 hours, and this is all part of the normal healing process. This does not mean that it is infected. There should be no attempt to actually remove that exudate. It will persist for 2 to 3 days. You want to teach the parents how to apply the diaper so it does not press against the circumcised area. Make sure that they're using the Vaseline or anti-ointment, whichever is ordered. We will also want to encourage them to change the diaper at least every 4 hours, because whether they've voided or stooled, because this is going to prevent from the diaper getting stuck to the penis, and that is something that you do not want to happen. These poor little newborns do not like that. Some of the patient teaching that goes along with circumcised newborns at home is located on page 617 for you guys to review. The picture on the right is once everything is healed. This is what the circumcised penis will look like. Since we just talked about circumcision and that it is a painful procedure, let's talk about neonate pain. Neonates do respond to pain. They do have pain. There is management of the pain, whether it's non-pharmacological or pharmacological. But some of the things that you need to know: what are some behavioral signs of a newborn that's in pain, because they can't tell you that they're having a pain that's a 4 out of 10. They usually have crying, and it can go from a whimper to a high-pitched, shrilly cry. Their facial expressions usually grimace, eye squeeze, brow contraction, usually a quivering tongue, an open mouth. The infant will flex and adduct their upper body and limbs because they're kind of withdrawing from that painful stimuli. There are different pain assessment tools that are used for newborns. There's 3 different ones that they talk about in your textbook on page 618. One of them is called NIPS, and this is the one Winchester uses. NIPS stands for Neonate Infant Pain Scale. The other one is a Premature Infant Pain Profile, which is called a PIP, P-I-P-P. Then there's a Neonate Pain Agitation and Sedation Scale, which is called an NPAS. So these are different tools that can be used. There are another one that is called CRIES, and that is listed on page 619 in your textbook. And it is a post-operative pain type scale, and it's giving the newborn a score in order for documentation purposes. So how do we manage neonate pain? We want to minimize the intensity, the duration, or the cause of the pain, and we want to maximize the neonate's ability to cope and recover from the pain. Non-pharmacological ways to do that: newborns want comfort and they want reduced pain, so they like to be swaddled or snuggled in some kind of a blanket. Usually mom can do the soothing, dad can do the soothing. Sometimes it's just non-nutritive sucking. When I say non-nutritive, that just means that we're not taking in nutrition. So we're not breastfeeding or we're not bottle feeding. Newborns like to suck. You will see them sometimes try to look for their hand as a soothing mechanism. Some of the things that can manifest the acute pain response in a neonate are listed on page 618 in box 23-5. We're going to talk a little bit about discharge planning and teaching. There is a lot of information that these parents get during a very short time and window. They usually go home with lots of booklets or information. So one of the couple of things I do want to make sure that we go over is safety. Infant safety is a big one. Car seat safety is another very big test question on boards on testing purposes, is knowing how to adequately put a newborn in a car seat, because it's huge. So there is a box on page 623 that goes over just in general safety for home care, and car seat safety actually starts on page 625. Before we talk about car seat safety, I want to talk about elimination. One of the things we need to teach the parents are they need to make sure that baby's getting adequate nutrition, whether it's breast or bottle. And it does make a little difference depending if it's a breast baby or a formula-fed baby on what mom's actually going to see and assess for. So we want to make sure that the baby is voiding or stooling. Urine and the number of voids, and what should we expect. So we should expect to see 2 to 6 voids in the first 1 to 3 days of life. So we should have 2 to 6 voids, and this is for the 1 to 3 days of life. Then it's usually a minimum of 6 to 8 voidings per day after that. There are changes to be expected in color and consistency of the stool. When newborns are born, they have a stool that's called meconium. It's very dark and tarry, thick and sticky. And then that will actually transition based on if it is a breastfed baby or a formula-fed baby. So for formula feedings, babies should have one stool every other day for the first week of life. It's typically pasty, semi-formed. Breastfed babies will have 3 stools every 24 hours for the first few weeks. Their stools are actually looser. They usually resemble mustard seeds. Your textbook says mustard with cottage cheese. For the most part, they've always looked like mustard seeds. The odor is actually less offensive in breastfed babies versus formula feeding. If you ever have a baby that you formula fed, just before you even feed it to the baby, it doesn't smell very pleasant. So their stools tend to be a little stinkier. The other thing is positioning. Positioning is always very important. We want to make sure that parents are keeping the baby safe. Babies need to be placed in a supine position during sleep. For the first year of life, they should not have extra blankets, they should not have pillows, they should not have a crib full of stuffed animals in their crib. They do not room share. We do not encourage newborns to sleep in the bed with mom and dad either, for safety reasons. The last thing on here before we actually talk about car seat safety, 2 things actually. Positioning, when we're talking about positioning and in the crib and having the baby in a supine position, when newborns are being fed, we also want to instruct parents never to prop a bottle up with a pillow. They should be holding with a good firm hold on the baby's head, and the baby should almost be in a almost like if they're sitting up in a chair-like position. You do not want to lay them flat because they can aspirate. You do not want to prop up a bottle with a pillow because they can aspirate. The other thing is clothing. We usually instruct parents to dress their child as if they were dressed. So we want to say, dress your child for the environment as you would dress yourself. So do not add more than one layer than you would be wearing as an adult. It's kind of a good concept to use. For babies, they lose heat very quickly through their heads, so usually keeping some type of a hat on them is also important.